Okay, we're now going to move on. I'd like to introduce you to Dr. James Scholey. He is joined us at the back of the room. Hi, James. He's going to come up, and he's going to, his subject is going to be taking care of your kidney. He is your nephrologist with the University Health Network, and so please give him a round of applause to talk about taking care of your kidney.
It's a terrific opportunity. I'd like to thank the organizing committee for the chance to come and speak with you today about kidney health. I share a large number of patients actually with Dr. Finelli, Dr. Jewett, and with Dr. Knox. And as a kidney specialist, I tend to see patients with renal cell cancer in three settings. The first one I see is patients before their operation, when there are issues about what will the impact of a resection be on their overall kidney function. And we deal with that with some regularity. The second setting that I see patients with commonly is after their surgery, and I see them there for two reasons. One is to monitor their ongoing kidney function and kidney health, and the second reason actually is to follow some of the complications that ensue with some of the new therapies for renal cell cancer, and to help the oncology team in terms of decisions about blood pressure and sometimes proteinuria, and I'll come back to that. The third and least common setting that I see patients with renal cell cancer is actually in the dialysis unit, and then uncommonly we see patients who require such significant resection of their kidney function that they're left with renal function that's no longer able to sustain them in a healthy manner, and they enter our dialysis programs. And actually, one of the patients that I enjoy the most on my dialysis shift is in his mid-80s. He's about 15 years out from his original diagnosis of renal cell cancer and has been a stable dialysis patient for 8 years and enjoys life to the fullest. So because of these settings, I pose three questions that I'd like to speak about today. The first is really related to why I see patients, and the question there is, what do your kidneys do exactly? It can be very shocking to have a diagnosis of renal cell cancer, and what we find, of course, is that when that presents itself to individuals, the question often is, well, what do my kidneys do? And what do I need to worry about if I'm facing a procedure that reduces my normal kidney mass? And the second question, which I'll relate it a little bit, is EGFR, and I think this is something all of us you hear in terms of your doctors, and it has some implications in terms of understanding what your level of kidney function is before your treatment, what level of kidney function you may have after your treatment, and what are the concerns that come along with using that to gauge overall kidney function. And the third then is what we often deal with after surgery is how do you maintain healthy kidneys? What are those circumstances that we worry most about in individuals who have sustained a reduction in their nephron mass because of necessary surgery? Now, one of the things I think that's interesting to think about and I'll talk about in two ways, is that the kidney functions as a filter and a processor, and the filter is why you hear terms like estimated glomerular filtration rate. That's a critical function of the kidney, and I'll go over that in some detail, and I'll talk about the processor aspects of the kidney. What is it that the kidney does once it filters your blood that allows you to maintain your day-to-day health? And then I'll talk about some of them, what might be more surprising systemic effects, ways in which the kidney affects your health outside of its normal function, which I think often surprise people and often guide the way in which we manage individuals in the clinic setting with our urology and oncology candidates. Now, of course, this audience needs no introduction to where kidneys are. You've looked likely at many imaging studies, and you know that thankfully, of course, most of us have two kidneys, and they reside in what we call the retroperitoneum, deep within the back. And they have a significant blood flow, which is shown in the right lower panel, in which you can see the aorta in red with the renal arteries going to the two. It's critical to understand, actually, that the kidneys see about 1/5 of all the blood that your heart pumps each day. So that each of us pump about 5 liters of blood a minute, and 1/5 of that, or a liter, ends up going to, divided into 2 to both of our kidneys. From that extraordinary blood flow that each kidney sees, it produces a filtrate. And it produces a filtrate in the part of the kidney called the filter, which is the glomerulus. And actually, that amounts to about 150 liters a day. So actually, when you think about it, in the hour of the last presentation, people with 2 normal kidneys have filtered about 6 liters of water into their kidney mass. Now, that's a large amount of volume over a day. It represents about 70 2-liter jugs of milk shown here, but there's jugs on each of your tables. Each of those jugs contains 2 liters, and an individual with 2 kidneys filtered 3 of those drugs since lunchtime about an hour ago, which is remarkable. That's the filtration aspect of the kidney. And it's interesting because thankfully that is such a large function that we have extraordinary reserve. And it's important that we have that reserve because we can undergo nephrectomy and reduce our overall filtration rate by half and not function too many deleterious consequences. Patients reach dialysis levels when their filtration rate falls to as low as 10 to 15 liters a day, or about 10% of their normal kidney function. So one of the important things to understand is that if we have normal, healthy kidney function, that we have tremendous reserve and ability to undergo reduction in nephron number. Of course, we want to understand what the impact of factors that can reduce that function over time. Now, on the left-hand side here is a light microscopy picture of the filter of the kidney. It's a capillary network, and it's important because it filters that 150 liters a day. Each of us have about 1 million of these filters in each of our kidneys that produce that 150 liters of filtrate. It's an interesting collection of capillaries, and when you think about it, those microscopic blood vessels that function as the kidney, you can understand that sometimes nephrologists and oncologists will see problems with the drugs that target the tyrosine kinase inhibitors that target vascular endothelial growth factor, because this is a very vascular structure. And indeed, it's one of the common reasons why I share patients with Dr. Knox. Now, shown beside that filter is a segment of the nephron, which is the kidney tubule, so that each filter is attached to a similar number of tubules, so that each of us have within each kidney 1 million tubules. And in many ways, shown on the right-hand panel, those tubules interspersed with blood vessels are very much like a bowl of spaghetti, in which at the beginning of each piece of spaghetti, there's a filter, and that filtrate traverses the course of that piece of spaghetti and emerges at the other end as urine volume. So that even though you and I filter at one end of the piece of spaghetti about 150 liters of water, at the other end, only about 1.5 liters of water emerges in 24 hours. So that interestingly enough, well, your kidneys filtered 3 of those jugs, only about 1% of that ended up in your bladder. Thankfully, because that means we can all sit here for more than an hour at a time. You can imagine the trouble we didn't have, but it shows you so that you and I filter 150 liters a day, and we produce about 1.5 liters of urine. 99% of all the water that is filtered by those glomeruli is reabsorbed and helps to maintain our normal state of hydration. It's interesting when you think, why would the kidney do that? And it's probably because when our ancestors were running around the plains of East Africa, evolving, there wasn't a lot of water in the environment, but there was a need to excrete nitrogenous waste. And by reabsorbing all the water that was filtered, it reduced our ability to find water. And thankfully, we have a lot of reserve. Now, within that nephron, you can see on the left-hand side is the filtration, that capillary network, and then the renal tubules, which reabsorb both salt, water, and secrete potassium and secrete nitrogenous waste. So it's this filtration and processing function for a variety of factors that is responsible for maintaining you and I in normal, healthy fashion. Now, water's one thing. We filter 150 liters. We excrete only 1.5 liters, and that gives us an ability to manage our water balance. What about salt? Well, salt is something that is important for health. It is important for day-to-day health in normal individuals with 2 kidney function and their blood pressure, but it's also important for kidney function. You and I probably eat about 200 millimoles or 7 grams of sodium. That's equivalent to the amount of sodium in that salt shaker. So it's pretty remarkable when you are sitting next door with salt and pepper shakers on the table to realize that you and I each day eat the equivalent of 1 salt shaker full of salt. And the kidney has an important role not only of excreting water that we drink, but it has a critical role in excreting the salt that we eat. If we were unable to excrete that salt, then we would progressively become more puffy and edematous, and actually, and that's a critical function. So salt is important because the kidney excretes it, and it's one of the things that we'll come back to when we talk about kidney health. I told you earlier that you and I can drink a lot of water in the kidney, and so in maintaining kidney health, we like not only to reduce the amount of sodium we eat to at least probably 4 grams a day, or about half what is shown there, but we don't need to drink more than about 1.5 to 2 liters of water. There's a lot of stories out there about the more water I drink, the healthier I am, and we certainly see this in young women walking down University Avenue or on the subway trains, drinking water all the time, and I'm not sure whether that's just to reduce their appetite and keep their stomachs full, but I think that there is no need to drink excess amounts of water to maintain your kidney health and overall general health, about 1.5 to 2 liters a day. Now, the other thing the kidney does that plays a critical role is that filtration process, and that is important, but also that processing allows the kidney to excrete potassium. And you and I eat a lot of potassium each day, about 2 to 3 grams, and potassium is commonly in orange juices, apple juice, fruit juices in general, and in bananas and other foods, and our kidneys have to excrete that. If our kidney function is impaired and we cannot manage potassium, then our potassium levels rise in our blood, and that can affect our heart function. And so that's one of the other things that we worry about, particularly in individuals after they've had a nephrectomy or a reduction in nephron size. Now, one of the key roles that the kidney plays that we might not think about is that it allows us to excrete what we call nitrogenous waste. Now, as you can see, I've shown a picture of a kidney, and the right lower panel shows a piece of steak or meat. And as we metabolize that meat, we have to excrete what are called nitrogenous wastes. And if we don't excrete those nitrogenous wastes, then those accumulate in our body and can make us feel unwell. And the kidney has to do that. And you and I, to maintain a healthy kidney over time, need to eat only about 1 to 1.5 grams protein per kilo per day. Now, when you and I eat meat, we also eat a lot of phosphate. And phosphate has a role in your bone health, and phosphate has to be, that we eat in excess of what our daily needs are, has to be excreted by the kidney. So that the kidney plays a key role in the maintenance of our hydration, our water intake and excretion, in the maintenance of our sodium balance by excreting that which we eat, in maintaining our potassium balance because we eat potassium each day, and in allowing us to excrete nitrogenous waste and to excrete phosphate, which can affect our bone health. And all of these factors are important, and all of them are considerations when individuals are expected to undergo a reduction in nephron mass and things that we have to review. And you can imagine that everyone that I see in clinic and everyone that I see referred by Dr. Finelli or by Dr. Jewett is assessed by a dietitian, so that they review those things in their diet that we can adjust to make sure that with their new level of kidney function, they can manage the daily requirements that their diet poses to them. Now, what are the systemic effects of the kidney? So the kidney is a filter and a processor, and we've talked about that. It's important in maintaining healthy kidney function to have dietitians and to be aware of those things in our diet and to be adjusted. What about the systemic effects? And these are where people don't realize the things that the kidney impacts on, and I think really have changed the way that we think about kidney function and how we interact. one of the remarkable things is shown here. So in the middle I've shown the kidney, and on the left-hand panel I've shown a heart. It turns out that your baseline kidney function is one of the most important determinants of your heart function. And that as kidney function declines, one of the most important effects of that decline in function is to lead to cardiovascular disease. And indeed, most patients who have impaired kidney function will not reach the dialysis unit to be looked after by physicians such as myself. They will die of a cardiovascular event. So this relationship between cardiac function and kidney function is important, and it has only really emerged in the last few years, and I'll show you a little bit more about that. Now, people may not realize that the kidney plays one of the most important roles in your bone health. We spend a lot of time, and certainly the lay press spends a lot of time telling us about how much calcium in postmenopausal women, whether they should consider estrogen replacement, and how much vitamin D we should take, focusing on our bone health. But indeed, actually, the kidney plays a key role. And one of the things we have to manage in patients whose kidney function isn't normal are those things that impact on their bone health. And maybe not surprisingly to everyone, the kidney plays a key role in maintaining your hemoglobin in your blood. As your kidney function declines, so too will your level of hemoglobin, and that's where you can become anemic. So the kidney plays this critical role, not only in filtering and processing, but it plays a critical role in maintaining your cardiovascular health, in particular your heart health. It plays a critical role in your bone health. And you'll hear a little bit more today about how exercise is important to maintain. It turns out that the kidney is a very important arbiter of your skeletal or muscle mass. And as you reach low levels of kidney function, it becomes increasingly difficult for individuals to maintain their muscle mass and muscle strength. And that becomes important as we go forward in terms of maintaining a level of activity to counteract the effects of declining kidney function. The last thing is that I talked to you about the heart, and that's your blood vessel health. And it also turns out that your kidney is an important determinant of cardiovascular health. And so events like stroke and peripheral vascular disease are all made worse. And so the kidney plays a central role not only in maintaining that balance in you and I, depending on what we eat and drink, but it also is a critical determinant of these factors in health. Now, most of the things that I talked to you about briefly in terms of the filtration and processing function don't become clinically significant until your kidney function is about 25% or less of normal. Most of these impacts that I'm showing in this particular picture become clinically important, and increasingly so when your kidney function is less than 60% of normal. So one of the interesting things is that some of the systemic effects of reduced kidney function emerge as important early considerations, and the filtration and processing effects will emerge as someone's kidney function declines to lower levels. And these are the issues that we talk about in clinic. Now, EGFR, what does it mean? The estimated glomerular filtration rate, well, I've told you that you and I, in normal individuals with 2 kidney function, filter 150 liters a day. So our glomerular filtration rate is 150 liters over 24 hours, or a value of about 100 mils per minute, 50 mils from each kidney. And so what the estimated GFR is saying, well, can we use parameters just like a measure in the blood to estimate the glomerular filtration rate? Because that tells us what we need to worry about in the patient. Is their kidney function normal? Where are they relative to 60%? Where are they relative to 25%? And the estimated GFR is a value that doesn't require anything except knowing how old you are, what your gender is, and what your serum creatinine is. And serum creatinine is an end product of muscle metabolism that is put into the blood by muscle and eliminated by the kidney. And as your kidney function declines, your muscles still put that end product into your blood, but their kidney's ability to excrete it declines. So the important thing to understand about creatinine in your blood is that as kidney function declines, the creatinine level rises. And that creatinine level rising allows us to estimate the GFR. And why is it important is shown by a paper published about 10 or 12 years ago in the panel on the right-hand side. It shows that if we estimate in a population of individuals their glomerular filtration rate, we can predict their death rates. And going on the y-axis on the lower part are individuals whose estimated GFR is greater than 60 mils per minute. And you can see that as there's a stepwise decline in your estimated GFR, as that kidney is filtering less blood, there's a sequential increase in your risk of death. And it turns out that risk, based on serum creatinine, occurs for cardiovascular events like stroke and heart attack, and finally, for even the risk of hospitalization. So that kidney health is very informative, and understanding the level of kidney function tells us what we need to be aware of. Again, if it's 60% or above, we're not too worried. 60% and below, we begin to worry about death, cardiovascular death, hospitalization. And as it reaches 25% or below, we begin to worry about filtration function and processing function, water, sodium, potassium, nitrogenous wastes, and phosphate. Now, how do you keep your kidneys healthy? And this is the issue that I usually deal with in individuals who present to us after they've had their nephrectomy, because when we talk about the issues of kidney function, we accept that there has to be a reduction in nephron mass. And then we're predicting what will happen after their surgery. And when I see them post-operatively in clinic, we're looking at what are those things that can preserve kidney health. Because if you've got reserve, but there's a step decrement in your overall kidney function because you lose kidney mass with a nephrectomy or a partial nephrectomy, what do you need to worry about? And the things that I'll talk about here really are three. And one of the things that I can tell you is that by walking into a dialysis unit, you can recognize what are the things that you need to avoid to preserve kidney health. So if I was to walk into my dialysis unit just a few blocks over at the Toronto General and look at the first 100 patients that came through the door to receive dialysis treatment, about 45 of those patients would have diabetes in the background. And another 25 of those patients would have a dominant risk factor of high blood pressure. And another 20 of those patients would have a risk factor of a variety of diseases that we call glomerulonephritis. Generally, those diseases in which albumin and protein appears in the urine. And after that, we've got about 10 to 15 patients. And that group includes those who have a family history of kidney disease, which is a special circumstance I haven't talked about today. So the most important way to maintain healthy kidney function, to maintain your kidney health, or to avoid the three things, or to be aware of the three things that are the most important reason for pushing people towards dialysis: diabetes, hypertension, and protein in the urine. Now, hypertension, shown here in this picture, causes an awful lot of problems, and you can see actually that as they've gone down from the brain to the eye to blood vessels to the kidney, and they show both a kidney in cross-section and that microvascular structure we call the glomerulus that's responsible for filtration. That's the target for high blood pressure, and of course the heart. So, in order to maintain healthy kidney function, you need to know your blood pressure, absolutely. You need to make sure that your blood pressure is monitored. And if your blood pressure is high, and these are fairly strict or very strict blood pressure, if your blood pressure standards, if your blood pressure is high, it needs to be treated. Untreated blood pressure is an important risk factor for declining kidney health, and an important risk factor that leads to people entering a dialysis unit. And as I've told you before, because it has a myriad of effects, most people with untreated blood pressure don't end up, or poorly treated blood pressure, they don't end up in a dialysis unit to be looked after by doctors like myself. They actually die of strokes, heart attacks, or peripheral vascular disease. But we can maintain kidney function. So hypertension and blood pressure is critical, and one of the most important factors for maintaining kidney health. We always encourage patients who face this issue, be it related to their ongoing health or to issues that arise from some of the medications used to treat renal cell cancer to monitor blood pressure at home. It's the most important way to ensure that your blood pressure is normal, or when treated, maintained within a normal range. Now, diabetes. Diabetes you can read about in the Globe and Mail with some regularity. It's today's health epidemic, and you can see shown in the left graph, it's probably pretty hard to read, is the number of individuals beginning in 1998, 99 in Canada with diabetes and going to 2008, 2009, I think, from here. And sadly, you can see that there's a progressive rise in the number of diabetic subjects. So to maintain, and diabetes is a disease that affects many organs, prominently your eyes and your kidneys. It's the most common cause of blindness in Canada. It's the most common cause of peripheral vascular disease. And from our perspective, the most common cause of impaired kidney function. And the most important reason why kidney function can progress in individuals and lead to end-stage renal failure. No province in Canada is spared, and as you can see, there's probably two places you might not want to live in Canada from a diabetic point of view. You sure might not want to be in Labrador, Newfoundland, and you might not want to be in Ontario. Sadly, Labrador, Newfoundland has the highest prevalence of diabetes in these statistics from Health Canada, and Ontario sits second. Not a place you want to be ranked second, and not a place you want to be ranked first. But it tells you that in Ontario, diabetes is a public health risk factor for many things, and for people concerned about their kidney health, it's number one. You can see here, this shows the prevalence of diabetes in Canada over the last decade, and this is about 5 years old now. And you can see that as we all get older, so along the x-axis is the age group, on the y-axis is the prevalence of diabetes, how many people have it. And if you look at the individuals, if you look at someone who's 65 to 75 years of age, almost a third of individuals in Canada have diabetes. That's extraordinary. And that impacts on their health, on their kidney health. So how do you do? Well, you want to make absolutely certain that your doctors check your fasting blood glucose and particularly monitor your weight. And if those issues become problematic, our dietitians in our healthcare team play another critical role, not only in managing the filtration and processing aspects of kidney function, but a key role in helping individuals maintain a healthy diet so that we don't put on weight. We all know as we age, we put on weight. And we all know as we age, we become increasingly sedentary. I know that myself, and that becomes an issue we have to be careful about going forward. Now the last relates to that other, how do you want to keep your kidney health healthy? You want to make sure that your kidney, your urine is tested for albumin. Albumin, or protein appearing in urine, is a risk factor for loss of kidney function over time, and actually a risk factor for cardiovascular disease. So that if I want to maintain kidney health, I want to be certain I know what my blood pressure is. I want to be certain that I know what my diabetic status is. And I want to be certain I know whether I have albumin in my urine. And I want to make sure that all three of those areas are followed as carefully as possible. And I especially want that to be the case if I've undergone a reduction in nephron mass as a consequence of necessary therapy for renal cell cancer. So to keep your kidneys healthy, know your blood pressure. Get tested for diabetes mellitus, and make sure that your physicians check your urine. So goals for today in a relatively brief time, talk a little bit about what kidneys do. When do we worry? Those things we worry about systemically when function's below 60%. Those things we worry about in terms of physiology when kidney function is below 25%. What does eGFR mean? Well, it's a way of estimating the filtration function of the kidney. It's an important parameter because it tells us about risk of important things like death. And how do you keep your kidney healthy? Blood pressure, diabetes, checking for albumin in your urine. So thanks very much for your attention.